Hi, I'm Tom Haney, and in this presentation I'm going to try to give you information that may help you to stay fit and healthy and avoid injury. Now before we get underway, I'd like to tell you that for credit from the LMHF Wellness Program Part 2, you must watch the video in its entirety, watch to the end, and then make a comment on each video with your name. Once confirmed by LMHF that you have watched the video in its entirety, your comments and name will be promptly removed. Thank you and enjoy. We're going to now talk about preventing slip, trip, and fall injuries. It's a serious issue, and it's certainly, I'll give you some statistics here. Well, first of all, let me give you a definition. A slip is when there's insufficient traction between your foot or shoe and the surface you're walking on, causing you to lose your balance and fall. A trip is when you hit something, causing you to lose your balance and fall. And a fall is any time that you lose your balance for any reason and fall to the ground. Hence, we call this slip, trip, and fall training. Now, why is it such a big issue? You'd think people would know better than to fall down because they could get hurt. Well, we do know better. But still, it's the third most common cause of workers' comp claims, and over 17% of the work-related injuries, the disabling injuries, are the result of slip, trip, and fall. So it's an issue. But that's not the issue I'm most concerned about is the statistic. I'm most concerned about you. And the list on this slide are some of the things that you might experience should you take a fall and cause an injury. Pain, inability to work, which means lost wages and perhaps temporary or permanent disability, reduced quality of life. When you can't do things and you're in pain all the time, that's a serious issue in terms of quality of life. Depression. It's almost funny talking about that at the moment. I don't mean really funny, but a lot of you may have been unable to do normal tasks because of our having to be locked in our homes for the last year plus. So depression is a serious concern we're looking at all the time, and inconvenience. Point is, these are issues. I don't want you to experience those, so we want you to be hypersensitive about how risky trip and fall can be and how damaging it can be to you. So I tried to put together a list of some of the more obvious factors that could relate, physical factors that could relate to slip, trip, and fall. One is age. I know at this stage I am far more likely to experience a fall than I would have when I was 20 or 30. I also know that the risk of my experiencing an injury is far greater than when I was 20 or 30. So the reality is age plays a factor. Body shape, size, and mass. What we have determined is that when people get to a certain size, it may change how they move, their stability, their agility, and as a consequence, it may in fact influence their risk of falling. Medical conditions, well, of course, there are many medical conditions that can cause dizziness or fainting or something else that could lead to a fall. And of course, the medicines we take for certain conditions. You know, if you even read the bottle that you take for your cold and flu, it says, don't drive a car or operate heavy equipment until you know how this medication is going to affect you. They're warning you that it could, in fact, put you at risk because it could affect how your body functions. Psychological factors, stress and distraction. I mean, it's almost amazing to me that we would have to pass a law in this state telling people that it's illegal to text while you're driving. Do you have to really be told that? That you can't have your eyes off of the road and be texting while you're driving a car? It seems almost silly, but the fact is, so many people think they can do it, they can get away with it, and many do not, and that's a concern. Stress, of course. Why is that a concern? Well, because it often is a distraction. If in fact you are thinking about other things in your life, whatever they happen to be, getting the kids off the bus, figuring out how you're going to manage whatever, it may in fact lead you to not being able to focus specifically on the task at hand. And we want your mind and your eye at the task you're doing when you're doing it. So we don't want you to be thinking about other things. Visual perceptions. Well, of course, if your eyesight fails at any level or begins to fail, distance, close up, depth perception, color, it may make it more difficult for you to perceive a hazard and therefore being able to avoid it. Decreased conditioning. You know, when you're young and fit and doing sports and all that, it's pretty easy to stay in pretty good shape. Then you have good reflexes and body conditions are good. That tends to fade over time, as we know, from aging and from the fact that life gets in the way. We have to do other things. So that may put us at greater risk. Loss of balance. A lot of people don't realize that balance is a combination of visual perception, vestibular, that is your inner ear, and the proprioception, that is the messaging that comes specifically from your feet and ankles that all are analyzed in your brain to help you to maintain balance in certain conditions. And some of those may fade over time, which puts you at greater risk. Walking. Now, it seems kind of silly to talk about walking because most have been doing it since you were 1 or 2 years old, but the reality is most falls occur when people are simply walking from one place to another. So even despite the fact that we are just walking into something we're very good at, why do falls occur? My opinion, partly is because we are so good at it, we don't focus. There's no attention given when you're simply moving from here to there. There has to be. You always have to put attention on what you're doing at the time. Moving too fast. When you're not taking your appropriate amount of time to do whatever task it is you're doing or moving from one place to another, that excess speed may put you at risk. We already talked about distraction, so I won't talk about that again. So what are some of the preventive things that you can do? One is clean up spills. Anything that would interfere with the traction between your shoe and the floor surface puts you at risk. So if you spill something, clean it up. And if you can't clean it up right away, mark it. Let everybody know that there is a spill, that something occurred here, and that they can avoid it so they don't fall as well. Sweep up trash, debris. It doesn't have to be a liquid in order to put you at risk. If you've ever stepped on an empty plastic water bottle or pop can or piece of plastic or sawdust, you know that a lot of things other than liquids can also interfere with your traction and put you at risk. Got to keep the areas of work cleaned, swept up, and avoiding those kinds of things. Keep obstacles out of walkways. That should be obvious, but a walkway, by definition, is a place for people to walk. That's not the place to put things down, to load up. It's not a storage area. It is a walk area, and it should be free of obstacles. And of course, those walkways need to be free of clutter as well. And then carpets and rugs should always be firmly attached to the floor or not in a position where they can be, the edges can be kicked up to become trip hazards, or that they can move around on a hard surface floor. There needs to be the appropriate action taken to make sure that rugs, carpets, and mats are secured. What are some of the other things? Close filing cabinets and doors and drawers. Why? Well, because although you could see them, the reality is you might not, because you're looking at something else, because you're focused on something else. You walk in and you manage to hit a door or a drawer that somebody or yourself inadvertently left open. That's a concern. Cables, hoses, wires should never cross a walkway. They should go over, they should be covered with a mat. Something should happen so that you do not have that obvious trip hazard in a walkway. And your areas of work should be well lit. If in fact light bulbs are burned out, notify somebody so we can get the lights replaced, and that you have, because if you can't see a hazard, you can't avoid it. So be sure that you do all of that. The appropriate footwear. Some of you may work in environments that have shoe policies because they want you to be safe and avoid any sort of slip or something landing on your feet kind of accident. But always choose the shoes, even at home, that are appropriate. I mean, I've seen lots of people, recently even, cutting their lawn in flip-flops, and I'm thinking, really? You're willing to put your feet at risk? Point is, the footwear that you choose should be appropriate based on the hazards that you may experience. So what do you do to avoid slipping at work? Take your time, pay attention. Trying to move too fast is a mistake because you make mistakes. Paying attention to your surroundings is a requirement because surroundings change, things change, and you need to be sensitive to the changes that are taking place. Let's talk about inclement weather. Hopefully we won't have any of that for a while, but there's some of the concerns. You have to make the changes in your gait, your walking style, based on the change in traction. If you're walking on slippery surfaces, obviously you need to walk differently. The right shoes or footwear is a big help. Even if you had to change them, you wear the appropriate footwear for outdoors, come into work, change them into your work shoes, but you need to have the appropriate footwear for the hazards that you may experience. Sunglasses tend to mitigate the risk of glare interfering with your ability to see things. And treating walking surfaces, of course. Ice is one of our biggest hazards, but by simply putting some salt or ice melting material on the ice, we can diminish its danger. So treating those areas just makes sense. I'm not going to go through all of this, but the reality is, and I've seen this now in many work environments, they have signs that say, walk like a penguin. What does that mean? It's the way that most of us who lived in Western New York for most of our lives know how to walk on ice. You keep the weight on your front leg, on the forward leg, so that it is well planted. You take smaller steps. You may even point your toes out to the sides because that gives you a wider base of support. When I said slip, trips, and falls are preventable, I didn't mean necessarily all of them. I just mean that to a large degree they're preventable. And here are some of the things that you can do. Modify your work areas to avoid hazards that might put you at risk. Practice good housekeeping. Put things away. You want to know where those tools are? They're going to be where they belong if you put them away after every use. Proper footwear. Just talked about that. Using ladders and stairs with caution. I'll make a mention of that in a minute. And practice safe walking procedure, particularly in areas that may be wet or slippery or icy or have something that might interfere with traction. So what causes slips? As I mentioned before, wet contaminants, food, drink, grease, oil, could easily raise the risk of a slip and a fall, or dry contaminants like sawdust, plastic, dust. Any of those that interfere with your traction put you at risk. That's why you need to clean up your work areas frequently to keep them from becoming a hazard. Be aware of the surface you're walking on. Hard surfaces like terrazzo and tile and marble can become quite slippery, especially if you have ice or snow on your shoes. Be sensitive when stepping onto a surface as to whether or not you're going to have good traction. Sloped surfaces are always a concern because on a sloped surface, gravity isn't working in your favor. If you lose traction, you will slide down the sloped surface, being pulled by gravity, and that can put you at risk. Loose tiles, big issue. For a lot of places, tiles become loosened over years of use and perhaps moisture, and those tiles are amazing slip hazards. Cleaning them up isn't that big a deal. A garbage can or a waste bag, picking them up, putting them there, taking them out to the curb for a pickup would be a reasonable way to solve that problem. Obviously, environmental factors, ice, snow, cold, frost. There are a lot of things that can change the surface that you might be having to navigate. So being sensitive to what's happening outside, even if when you come in the morning and the ground is just wet, if by afternoon it's frozen and by evening it's got an inch of snow on it, that's a pretty big change and a pretty hazardous condition if you're not sensitive to it and making the appropriate adjustments. If you get outside and you go hiking or camping or hunting and you work on, are on park or recreational areas, those surfaces are not necessarily well maintained. They could be cobblestone or brick or just stone or unfinished, and as a consequence, you have to be very sensitive about walking on those surfaces and how you place your feet. What causes trips? Well, to a large degree, it's something protruding into a walkway. This shows a couple of pictures of a pallet protruding into a walkway. This one I think is particularly, the pictures here. One is you can see the cords crossing over a walkway, and of course underneath the cords is a rug that they could have put over the top of the cords, and that would have solved the problem. In the bottom picture, right on the concrete, if you can see it, it says, "Keep aisle clear." And somebody thought it was okay to drop a pallet right in front of the sign that warns them to keep the aisles clear. Why? Well, because we all get lazy or we just not thinking. You gotta be constantly aware and thinking about hazards. That may not be your primary job, but it's a job that all of us share, keeping ourselves and each other safe on the job. Stairs, big concern. 4,000 deaths every year from stair falls, especially in industrial and commercial environments. The stairs are often concrete or metal, not very forgiving if you should fall. Walking stairs is pretty simple because they are usually very uniform. But if the stairs are in disrepair, if there's a runner or carpet on the stairs and that becomes worn out, or the stairs are disproportionately separated from each other, it becomes an easy trip hazard. And you have to be very sensitive when you're working or going up and down stairs about the dangers associated with that. Carrying things can always increase the risk of falling, and it particularly becomes an issue, or let's say more so, when you're on stairs. This, I give you the no on this. This is like a safety person's nightmare. Person carrying that item can't see over it or around it. They need two hands to hold it, which means they can't use the handrail. That's a disaster waiting to happen. The key is when you have to move something up or down the stairs, what you should do is break it down into smaller parts so you can carry it in one arm. Put the other hand on the safety device on your staircase, which is the handrail, so you can maintain or regain your balance should you have any sort of a slip or misstep. If you are involved in any sort of materials handling, use the equipment that might be provided for you. It might be a cart or a two-wheel dolly or a four-wheel dolly. Use them because it allows you to be in a better position to maintain your balance and avoid a fall and not have to carry a large or heavy object. So here are the basic rules of thumb. If you drop it, pick it up. If you spill it, wipe it up. Go where you're looking and look where you're going. Remember, there is always time for safety. We want you to stay healthy. We want you to stay fit. So be safe and thank you.